Hi guys, my name is Heather. I'm a hygienist with GuruNanda, and today we're going to be talking about the process of getting an implant. This is a question I get from a lot of my patients. They want to know what to expect. Does it hurt? How long is it going to take? So today we're going to be answering all of those questions. First, what is an implant? So an implant is a titanium, usually titanium. There's different types of materials, but the most common material that dentists use or periodontists are titanium. So it's a titanium screw that goes into the bone and acts as a root of the tooth, and then a crown gets put on top so it functions like a normal tooth. What's nice about an implant is that you can do either a singular tooth, so you don't have to do a bridge. If you need a full arch replaced, you don't want to wear dentures, you can do an implanted denture. That's an awesome option. The need for implants can be from different reasons. So some people have decay issues, some people maybe had a lot of bone loss in the area and lost a tooth, or someone might be congenitally missing a tooth, which means that they weren't born with a tooth and they might choose to replace that area with an implant. So what to expect? So now you're going to need a consultation first to determine how much bone you have in the area. If the bone is healthy for an implant, the dentist will go over all of those things with you. Now, if it's determined that you need a bone graft or, if you need an extraction, that would be the first step. So you go in, get the extraction done of the tooth and get a bone graft, or if you don't need the extraction, you would get the bone graft. Then you're going to let the bone heal. So you're going to want your bone to integrate with the grafting material, and this takes about 3 months. After the 3 months have went by, you're going to come in for the actual implant. So now a lot of the times when people say implant, they think it's the crown portion, but no. So you're going to get the implant, which is the screw portion, and then wait another 3 months to get the crown put on top. So sometimes this procedure can take anywhere from 6 months to a year, depending on how well you're healing. You'll go in multiple times throughout those months to take an x-ray to see how everything's healing, and then that's how you'll determine how long it's going to take for you. That's it. If someone has a question, is it going to cost? It's going to definitely cost something. Implants are quite expensive, but some patients ask, is it painful? And getting an implant is a minor surgery. Now you'll be fully numbed up for it or sedated, so you won't feel anything, and then you might get a little bit swollen after. You'll be sore for the first few days, but typically patients do really well and they don't complain of any pain. So that's what to expect when getting an implant. I do have another video explaining how to care for an implant, and I can make a more in-depth one if you guys want me to go over that. But I just wanted to go over what to expect when you need an implant. Okay, so that's it for today's video. I'll catch you in the next one. Bye.